Hi, my name is Dr. Dalia Rothstein, and I'd like to welcome you to this web-based seminar on multiple sclerosis and CCSVI. CCSVI is a new theory of what goes wrong in multiple sclerosis. Everyone has been talking about what's being called the liberation procedure, a treatment designed to correct CCSVI. I'm a fourth-year neurology resident at the University of Toronto, and I work part-time in the MS clinic at St. Michael's Hospital. I designed this video to answer the most common questions that people with MS have about CCSVI. This information was current as of the beginning of January 2011, but keep in mind that new information is regularly being released. You won't find a perfect answer here as to what you should do about CCSVI. We will review what is known, and different people might come to different conclusions. This video takes about 10 minutes to watch. You should turn up the volume on your screen to the max if you haven't done so already. So what exactly is CCSVI? No, it is not a spin-off of a popular television show involving some dashing crime scene investigators, and I'm apparently not the only one who noticed that the two names are dangerously similar. The letters stand for chronic cerebrospinal venous insufficiency. It is a relatively new theory introduced by an Italian vascular surgeon, Dr. Paolo Zamboni, in 2007. He suggested that MS may be a vascular problem, which means a problem with the blood vessels. Specifically, he argued that MS is related to the blockage of the veins that drain blood from the brain back to the heart. Here you can see one of the pictures taken by Dr. Zamboni using dye to light up one of the narrowed neck veins. In contrast to Dr. Zamboni, most neurologists and researchers believe that MS is an autoimmune disease. An autoimmune disease is the body attacks itself. In MS, immune cells in the body attack the protective myelin sheath that helps conduct the nervous signals in the brain and spinal cord. On MRI scans, the destroyed areas look like white spots. Dr. Zamboni instead argues that MS is caused by backflow of blood into the brain, like a pipe getting blocked causing water to spurt back up. It is unclear why the backflow of blood should cause white spots in the brain. Dr. Zamboni believes it may be related to iron being transferred from the blood into the surrounding brain tissue. However, imaging studies show that there is an increase in iron found in brain tissues in many different neurological disorders. There are some diseases that cause higher concentrations of iron in the brain and other body tissues, but are not associated with the development of MS. It is also unclear that neck vein blockage leads to significant backflow. When blood vessels are blocked in the body, other small vessels, called collaterals, sprout up quickly to provide other ways for the blood to get around the blockage. We do see these collaterals in patients with neck vein blockages, and many doctors believe that because of this, the neck vein blockages are unlikely to cause serious consequences. How might the Zamboni treatment work to relieve the venous blockages? As you can see in this illustration, a long wire or catheter is threaded into the affected neck vein, and then the balloon on the tip is inflated to open up the vein. Some doctors leave a wire mesh stent in place since veins often collapse down again after the catheter and balloon are removed. Risks involved in performing this procedure mostly relate to postoperative headache, infection, blood vessel clots, and most often bleeding or bruising at the insertion site in the groin. Patients with stents have to go on blood thinner medication, which increases the risk of bleeding. Stents may also dislodge, migrating up into the brain or down into the heart, leading to stroke or heart damage. In at least 2 documented cases, patients have died from complications of the CCSVI procedure with stenting. Dr. Simka and colleagues who have performed the procedure in at least 347 patients in Poland reported serious complications in 2.1% of patients. In Dr. Zamboni's first study, he screened patients for venous blockages using ultrasound imaging. Dr. Zamboni set out ultrasound criteria for CCSVI requiring at least 2 out of 5 signs of venous blockage. These criteria were used because it is not always obvious where there is a blockage on ultrasound. We will discuss more about that later. Dr. Zamboni studied 65 MS patients and 235 subjects without MS. He stated that 100% of the MS patients had CCSVI. None of the 235 subjects without MS met these criteria. This was a very exciting result. Dr. Zamboni is a surgeon. His own wife was suffering from MS, so he decided to push ahead to see if MS patients would improve when their blocked veins were surgically opened. He performed the procedure on 65 patients with MS who had proven neck vein blockages on ultrasound. Many of the patients were also on a disease-modifying drug, one of the injectable drugs proven to decrease the number of relapses in patients with relapsing remitting MS. He reported that in the year after surgery, the number of relapse-free patients doubled. His patients also had an overall improvement in functional and quality of life scores after surgery. Most of the benefits were seen in patients with relapsing remitting MS. Patients with primary progressive and secondary progressive MS had minimal benefit. When Dr. Zamboni and his colleagues published their results, many people were extremely interested. Several neurologists decided to repeat Dr. Zamboni's studies for themselves. When a promising new idea comes on the scene in medicine, the first question that gets asked is, can these results be reproduced? If the results cannot be reproduced, then they may have been a coincidence or the result of bias. 2 small studies of CCSVI were recently published in August of last year. One study performed in Germany enrolled 56 MS patients and 26 healthy controls. Ultrasound imaging was performed using the same methods as Dr. Zamboni's group. None of the subjects in either group had 2 or more signs of venous blockage as needed for CCSVI. Another study was performed in Sweden and used MRV to look for venous blockages. 21 MS patients and 20 healthy controls were examined. 3 of the MS patients demonstrated blockages in their neck veins. There was no significant difference in the blood flow patterns comparing the MS patients with the healthy controls. A third study by a Dutch group was published in November. This group used MRV to evaluate 20 MS patients and 20 healthy controls. 50% of the MS patients had CCSVI, but so did 40% of the controls. The authors concluded that CCSVI is unlikely to be the cause of the abnormalities in MS. At this point, you might be left scratching your head. There are clearly some glaring differences between the studies. There are 2 different imaging techniques being performed, one using ultrasound and the other using MRV. Dr. Zamboni's original approach involved using ultrasound. However, there can be a lot of variability between the findings of different ultrasound technicians. Ultrasound pictures are grainy. Even the act of performing the ultrasound by pressing the probe against the skin can make the veins look blocked. The veins can be obscured by other structures in between themselves and the skin. Dr. Depp used the same ultrasound technique as Dr. Zamboni, but couldn't identify a single case of CCSVI. For this reason, some studies, like the one in Sweden, are trying to look at the neck veins using MRV, a type of MRI imaging that can reveal blockages in the vein. MRV can give more reproducible pictures than ultrasound. However, some have argued that MRV is not as good as ultrasound at picking up abnormal blood flow and subtle cases of CCSVI. Dr. Zamboni has been the only physician to publish studies looking at outcomes from the CCSVI treatment, so we don't have any other results to compare to his on this front. I can tell you from working in the MS clinic that some patients come back saying they are feeling better, but others haven't noticed any difference. The patients with negative stories aren't getting publicized to the same extent in the media. So I don't think it's good enough to rely only on what you've heard on the radio or TV. The best that we can do right now is to look at the Zamboni study and ask ourselves if the methods are trustworthy. One concern that has been raised is that because patients were also on the injectable MS drugs, their improvement might have been due at least in part to the drugs. Another possibility is that some of the benefits might be due to a placebo effect. It has been proven that when some patients are given an active pill and some are given a sugar pill, the patients on the sugar pill also improve. The positive effect of the sugar pill is known as the placebo effect. It's known from other studies looking at MS patients receiving a placebo pill compared to an active drug that the placebo effect can give a 30 to 50% improvement in symptoms. If Dr. Zamboni had performed a mock procedure on some patients and a real procedure on others, then we would have been able to see whether the CCSVI treatment is offering a benefit beyond the placebo effect. This approach is considered the gold standard for high-quality medical research. Some researchers and doctors also wonder about the role of the placebo effect because patients' most responsive symptoms have been the more subjective ones. There are some symptoms in MS which are relatively subjective, such as fatigue and cloudy thinking. There are others like weakness and double vision, which are more objective. We've heard very few reports of improvement in the objective symptoms after surgery. In addition, from Dr. Zamboni's report, patients' improvement was declining by the end of the study at 18 months. Now that we've reviewed what's known about CCSVI, let's summarize the pros and cons. On the one hand, it is based on an original idea. However, there is no good scientific explanation for why CCSVI should cause the white matter spots of MS. Theory aside, let's look at the numbers. Dr. Zamboni found that 100% of MS patients had CCSVI on ultrasound screening, but none of healthy controls did. On the other hand, other investigators have not been able to reproduce these findings. Turning to the procedure itself, Dr. Zamboni's study and individual patients report improvement. But are there other factors that may explain this improvement, and will it last in the long term? CCSVI treatment is a relatively fast and low-risk procedure, yet it is still invasive. Bleeding and bruising are relatively common. Heart attack, stroke, and death are possible complications. The debate continues amongst neurologists, MS patients, policymakers, and the general public. For the present, researchers are moving ahead looking at how common the neck vein blockages are in MS patients. Most of the research community thinks that it is too early to try out the CCSVI treatment, given that we're not sure if blocked neck veins are truly a cause of MS. Some people are urging neurologists to start clinical trials of CCSVI treatment. This means that the procedure would only be performed under the supervision of a research board, and that the results would be published for everyone to learn from. Other people believe that it should be freely available to anyone who wants it. What do you believe? It is up to you to decide. I have done my best to give you complete information as of January 2011, when this presentation was being put together. Keep in mind, though, that our level of knowledge about CCSVI is changing as more research comes out. What you and I believe about CCSVI may also change as we see the new results. This is the end of the talk. Thanks for listening. Please fill out the survey if you have watched the full presentation and you have MS. The link is at the top of the screen. Your answers will help us to refine the information about CCSVI that we provide to patients in the future.